Hello everyone, I am Fathima M A, Assistant Professor, Department of Medical Laboratory Technology, Yenepoya School of Allied Health Science. So today our topic is erythrocyte sedimentation rate, specific learning objective. At the end of the session, students should be able to define ESR and explain the principle of ESR, list out the stages of ESR, explain the various method of ESR analysis, list out the reference interval of ESR, list out the conditions associated with increased ESR value. So first is definition of ESR or erythrocyte sedimentation rate. So erythrocyte is red cell, sedimentation means settling, rate is amount in given time. So the measurement of the rate at which erythrocytes settle from the plasma in anticoagulated blood is ESR or erythrocyte sedimentation rate. Moving to the principle of ESR. So when the anticoagulated blood in a tube is allowed to stand vertically, the red cells will settle towards the bottom of the tube till they form a packed column in a given interval of time. The process of sedimentation is known as erythrocyte sedimentation rate. Moving on to stages of erythrocyte sedimentation. So the total time of ESR is 1 hour. In that, initial 10 minutes is stage of aggregation or relax formation. Next 40 minutes is stage of sedimentation or settling, and the final 10 minutes is stage of packing. So as we can see, first is stage of aggregation or relax formation, next is stage of settling, and the final stage is stage of packing. Next is methods of estimation of ESR. So there are manual method and automated methods. So the manual methods are Westgren method, Winthrop's method and micro ESR. Automated method is using benchtop analyzers. So Westgren method requirements are Westgren pipette or tube, Westgren stand, anticoagulated blood. Anticoagulant of choice is trisodium citrate in 4:1 ratio. Westgren method. So mix the anticoagulant blood sample thoroughly. The Westgren tube is filled with blood up to the 0 mark. The rubber bulb or mechanical device should be used for filling. Mouth pipetting should be avoided. There should be no air bubbles in the blood, and the tube is placed directly in the vertical position in the ESR stand, and it should be left undisturbed for 1 hour. After exactly 1 hour, the height of the column of the plasma above the red cell column is measured in millimeters. ESR is expressed in millimeter per hour. So the advantage of Westgren method is it is more reliable and gives accurate result. Disadvantages are more blood is required, difficult to fill blood in the tube, mouth pipetting can be hazardous. Next is Winthrop's method used to estimate both ESR and PCV. Requirements are Winthrop's pipette, Winthrop's stand, Pasteur pipette, anticoagulated blood. Anticoagulants of choice are EDTA or double oxalate. Winthrop's method. So we have to mix the anticoagulated blood thoroughly, then fill the Winthrop's tube by using Pasteur pipette up to exactly the 0 mark, then place the tube vertically in the stand, and exactly after finishing of 1 hour we have to measure the ESR level. Modified Westgren method. In this method, EDTA is the anticoagulant used instead of citrate. So 2 ml of EDTA blood is diluted with 0.5 ml of 3.8% of trisodium citrate or 0.85% of sodium chloride. Microsedimentation method. In this method, capillary blood is collected, which is useful in case of infants. Blood should be filled into the capillary tube. The bottom end of the tube should be sealed. The capillary tube is sticked on a clean wall and the length of the RBC column is measured using a scale after exact 1 hour and the tube is discarded after use. Next is the automated method, automated benchtop analyzer. So blood is collected in cuvettes, sample is left to sediment, designed to measure 20 blood sample at a time. Results which is available in the automated benchtop analyzer is comparable to vestibular method. Results are available in approximately 25 minutes. Working principle of automated benchtop analyzer. Blood is collected in a special cuvette. Sample is mixed by instrument. Sample is then allowed to stand at 18 degrees slant from the vertical. Optoelectrical sensors will measure the ESR and the data which are available is elaborated and printed by the instrument. Advantages of automated method: less time consuming, provides increased safety for the technician, interface with the laboratory information system, that is LIS, uses small volume of sample, provides more accurate results. Next is sources of error in ESR analysis: improper ratio of blood and anticoagulant, hemolyzed or clotted blood sample, presence of air bubble in the tube, error due to sunlight, small bore size of the tube, dirty or wet tube or tilted ESR tube. Also delay in performing the test. Reference interval of ESR in males less than 50 years 0 to 15 mm per hour, males more than 50 years 0 to 20 mm per hour, females less than 50 years 0 to 20 mm per hour, female more than 50 years 0 to 30 mm per hour, children 0 to 10 mm per hour. Physiological factors that increases ESR: old age, female sex and pregnancy. Pathological condition associated with an increased ESR level is rheumatic fever, rheumatoid arthritis, temporal arthritis, acute myocardial infarction, malignancy, tuberculosis and anemia. Conditions associated with very high ESR, that is more than 100 mm per hour: multiple myeloma, connective tissue disorders like SLE or other autoimmune disorders, tuberculosis, malignancy and severe anemia. Summary: ESR is a measurement of the rate at which the erythrocytes settle from the plasma in an anticoagulated blood. There are various manual and automated methods for ESR estimation. Increased ESR level is associated with some pathological conditions. References. Thank you.